Is the flu less dangerous than COVID? Let's look at the death rates. No, it's not. They're similar in prevalence and in death rate. So we are saying that our response now that we know the facts, it's time to get back to work.
That video has been seen more than 5 million times. It's been retweeted by such high-profile people as Elon Musk, and it's being debunked by scores of medical professionals. The video features two owners of urgent care facilities in Bakersfield saying that the outbreak is no more dangerous than the flu, and maybe it's time that Californians get back to work. One of those doctors, Dr. Dan Erickson with Accelerated Urgent Care, joins us now live. Doctor, thank you for being with us to share your views. We appreciate it.
Thank you.
All right, so can you explain for people that didn't see that video the bottom line point of it and why it was so important for you to make it?
Well, the press had asked me, they said, we know you're doing a lot of testing. Can you please let us know what your results are? So, you know, I live in Kern County, 900,000 people. There's 3 basic networks. I said, why don't we get together and I'll just tell you my total tests and my positives, which I did at the time was 5,200 tests and about 413, or excuse me, at the time it was 340 positives. Currently, it's about 6,000 tests with 413 positives. So I said, this is our raw data. This isn't a biostatistical analysis, but they had been asking me, since you're doing most of the testing in Kern County, can you please give us an update? So I wasn't really giving a detailed, you know, clinically controlled data that was biostatistically analyzed. I was giving raw data because the community had asked me, what is your data? And I said, well, it's about 6.5 to 7%. Right now, it's about 7.3. And I realized that it's not randomized. Our early data was from patients with cough, fever, shortness of breath. And now we're doing more randomized data where people are sent in by their employer, you know, hundreds at a time, and we just take all comers and we test them. So it's getting a little more randomized. But in no way was I, you know, stating data that have been, you know, in trials. It has not been analyzed. It is not published. It is raw data for the county of Kern.
Again, raw data of people coming to an urgent care center. So it's already kind of a selected population. But are you saying that it's no worse than the flu?
Well, I'm going to pivot to a discussion I've watched with Dr. Giseki, and Dr. Tednell out of the chief epidemiologist in Sweden. I've been watching their press releases, and they are saying this is...
But I want to interrupt you. I've seen those interviews, and Sweden's very different than here. To make the comparison, it doesn't... Even their nursing homes, we have hundreds of people in a nursing home. They have under 10 people in a nursing home. So it kind of... They live individually.
Sweden has large nursing homes, actually. They're known for large nursing homes. Norway is the one that has the small nursing homes. Sweden has very large, hundreds of people in nursing homes, per the review I watched today.
Right,
and so the comparison I'm making is that this flu season has been like a severe flu. Per Dr. Witowski, who works out of New York and is a biostatistician, he is saying this is similar to a severe flu. So I'm pivoting the discussion to say this is what the epidemiologists, these guys are analyzing the biostatistics and really giving us the bottom line.
But one stat that's pretty objective is deaths, because testing you can, you know, deaths. Right now, the deaths for California, 4.6 deaths per 100,000. In Sweden, it's 22 deaths per 100,000. Aren't we doing better than we're doing in Sweden?
You can't say that. You have to watch the full cycle of disease. California is 175 per million. And 225 per million in Sweden. You have to, again, we're going to know the truth of that answer once we run the full cycle of disease, because everything right now is sort of hearsay. You have to watch the full cycle of it and then look back on it. Every epidemiologist I talk to right now says you can't make that decision right now.
And even Dr. Fauci says things are delayed. We don't know really where we are. We're looking at data coming in that may be 2-week delayed. But have you seen COVID? I mean, I've seen COVID. And in a certain subset of the population, older people, metabolic syndrome, obesity, hypertension, hypercholesterolemic, insulin resistant, antiphospholipid syndrome. It isn't the flu. It's a devastating illness, kills people in a couple of days. I've never seen anything like it. Now, I can understand how people can equate it with the flu, but in that risk population, it's devastation. Can't we at least say that?
And I've seen the flu be devastating in that same population. In Kern County right now, currently we have, out of 3 major hospitals, we have 14 patients in hospital with the flu, and 3 of them are on ventilators. I asked them what their capacity is today, and they said we're at 40%. They've shut down floors. They've furloughed some doctors, And they said, we absolutely have surge capacity in Kern County right now. Should we get a second wave? They don't have their usual patience. And they're kind of frustrated right now because the volume has been so low.
So the American College of Emergency Physicians and the American Academy of Emergency Medicine has some issues with what you've said. We want to put up on the screen their joint statement. It says that jointly and emphatically condemn the recent opinions released by Dr. Erickson and Dr. Masahi as owners of the local urgent care clinics. It appears these two individuals are releasing biased, non-peer-reviewed data to advance their personal financial interests without regard for the public's health. That's quite a statement. What's your response, and is this about benefiting your personal financial statement?
Well, let's talk to Dr. David Lang out of Wisconsin, who I called and did a 20-minute Zoom interview, who had the exact same opinion, and he has nothing financially to gain. He said our hospital, as a low census, they're cutting our hours, and he said, here's the thing. Patients are waiting to come in for chest pain. He said, I worked last night. I said, tell me what happened. He said, I had a patient come in, was having an MI, but it started 3 days ago. But he said, I was afraid of COVID, so I stayed home. This is happening. This is not conjecture.
That
this is
true.
an ER
that
doctor telling me about his night shift.
That is being reported widely, that people are delaying coming in for routine medical problems, some of which are devastating. Even the 5 reported cases of stroke from COVID in young people, the strokes were more serious because those patients delayed coming in. They didn't know they had COVID. They were afraid of COVID. So yes, that point we all categorically agree upon. Please, everybody, go to the hospital if you have medical symptoms.
So what do you want to see in terms of the policy in the state of California going forward based off of what you have learned?
This discussion, to me, is really centered on herd immunity and how we get it. Herd immunity, between 50 and 80%, once the population gets the virus, then the virus starts to die out. It has nowhere left to go. And for flu, we have a vaccine. It helps us to get towards herd immunity quicker. The CDC reports that about 30% of the time, they'll have the right strain, so it'll help us toward herd immunity.
But hang on,
herd immunity will happen anyways.
That's 60% of the people. It might if we can't come up with a vaccine in time. But that's 60% of the population. And if the 2 to 4% fatality rate holds, that's a massive number of dead people.
Right, but again. I'm quoting the epidemiologist, who's the chief epidemiologist in Sweden. They're saying this virus is going to run its course, and every country will likely have similar numbers when it's over, whether you sheltered in place, which I listened to Dr. Gesicki today, and he said sheltering in place and social distancing has virtually no data to support it. Hand washing absolutely does, but the other things are things we're doing that may not have a lot of data. So when people come against me and say, you don't have any data, I say, let's please look at the data for social distancing and for isolation.
And for the doctors that say that what you're saying right now is reckless and dangerous and may hurt people in the process, what do you say?
Well, let's look at the collateral damage of almost everybody being affected by a shutdown. I'm a physician. I take care of patients. I took a Hippocratic oath. My goal is to take care of the people and not put them in a dangerous position. And when my patient called me today and said, can you refill my alprazolam? My anxiety is off the shelf. My husband's out of work. The collateral damage to shutting down an economy has to be considered because it is causing psychiatric instability, depression, anxiety. And this is firsthand things I've witnessed. So you have to think about it as a balancing act. You have to balance the collateral damage with the medical illness and say which one has a worse effect on society.
All right. Well, Dr. Erickson, thank you for sharing your views.